And joining us now live to discuss this and all things COVID and also the vaccines is Dr. EBONY JADE HILTON. She is the medical director for GOODSTOCK Consulting and also an associate professor at the University of Virginia. Welcome, Dr. Hilton.
Yeah, thank you for having me.
Nice to see you today. Well, we understand that you have some knowledge of the variant from South Africa.
Yes, we know that we now have our first couple of cases of patients being diagnosed with the B1351. You know, we name it all these things, but it's a variant, it's a mutant of the wild type COVID-19 that we've seen. And the first two cases being in South Carolina, where I'm from.
That's interesting. Do you have any idea of how severe this could be? How many people have it? Have they been able to gather any type of substantial data on this, or is it still a situation where there's so many unknowns?
Right. I think it is one of those things where we don't do surveillance sequencing as readily as other countries. So whether or not there are many other states that have this variant known is likely so. That South Carolina is not alone in having persons who have the South African mutation. Now, that being the case, what do we do with this information? Well, the good thing is that we do have a vaccine now that's in place. We have the Pfizer, the Moderna, and soon to be the Johnson & Johnson vaccine that I do think was going to be approved through the EUA. And what we know is that these vaccines have shown that they are also effective against the South African virus itself. So it's important that the public know and trust the fact that we do have methods that we can combat this, but it takes all of us to prevent the spread of these viruses so they are not allowed to mutate and potentially make our vaccines ineffective.
Dr. Hilton, let's talk about trust. Let's face it, in minority communities, there is a mistrust of the medical profession and the healthcare profession. There's so much information that doesn't quite trickle down, or the cost of healthcare makes it difficult. How do African Americans, Black people, minorities, how do they deal with what's going on with this virus, knowing that they have these additional challenges?
Right. And, you know, the trust is rooted in some true scarring of what the medical community has done to the Black community. And I think the first thing to heal that process is just acknowledging that, to have truth and transparency, to say, yes, we did that. How do we make sure that we don't do that for the generations to come? Right. Because we know historically Black people were left out of getting treatments or being afforded treatments for things that cost us our lives. And because of that, we see that we have a shorter lifespan. On average, the life expectancy for African Americans is only 75 years old. For Caucasian Americans, we're looking at half a decade, if not more, older than us. And so how do we make sure that we are getting the information to the most vulnerable, the most targeted communities? How do we reverse some of these policies and prioritize communication in the most effective way, which means matching the messenger to the message?
And Dr. Hilton, if you could share a little bit about your story, because you had a first as an African-American female anesthesiologist, is that correct?
That is true. So yes, so I was the first African-American female anesthesiologist to be hired at the Medical University of South Carolina in 2013. And that was since its opening in 1824. And even here at the University of Virginia, I am also the first and the only African-American female anesthesiologist. We have many firsts, and I don't say that with much pride. It's actually in sadness, because I know there are many who should have been before me, and many that helped to pave the way for me to have this opportunity. But because of that, you know, I make it my passion to say, I may be the first, but I refuse to be the last. And how can we make sure that we are making our physician population as diverse as our public population, so we can introduce these issues of equity and have those addressed up front and not afterwards?
Do you think it's because there's not enough students who want to become doctors? I mean, if we saw more Black doctors, there would hopefully be less disparities in healthcare, and we would see more information when we have troubles like this pandemic or any other healthcare issues. What's your perspective on this?
Right. I think it has little to do with the energy to become a doctor. I think what we have to face is that many of our Black and brown communities are set up to not have the infrastructure in place that it takes to get into medical school. If we're not resourcing our elementary schools, if we're having people, our little children, not able to read at a third grade level, we can't expect them to become equipped to pass the tests that are necessary to get into medical school. And so we have to really start thinking about what happens, not only for that third grader, but what happens when that third grader was actually in utero within his mom? How was his brain and his organs allowed to develop? Or was he born prematurely? Did he already start the life on this hamster wheel trying to catch up? And so we have to look at life in holistically and look at all the disparities and how they compound on each other to lead to one life story looking in one direction and another going into the other direction. There are many flaws of our system that we have to tackle at once.
And Dr. Hilton, we're almost out of time, but one last question going back to COVID and this variant. Is there anything we can do to protect ourselves against all these new strains that we're hearing about coming from other countries?
Yes, for sure. The reason to explain what these mutations are, what we know is that viruses are very smart, but that they, in order to learn your body or to trick and to become these mutants, they have to be able to dwell within a person for those mutations to occur. So how do we stop from these multiple mutations being prevalent within our country? Well, we stop the spread of the virus in the first place. And I know many people are saying, when can I get my vaccine? But truthfully, the most effective thing that you can do right now is to wear your mask, to wash your hands, to avoid large crowds, because it's in the passing of viruses from person to person that these mutations are allowed to occur in the first place. And unfortunately, there's a possibility that we can get a mutant that is no longer covered by our vaccines, and that will put us in a really difficult space of starting all the way over. So again, in order to prevent these mutations from happening, we have to stop the spread of the virus. So practice those safety precautions, and we can get through this together.
Critical information. Thank you so much for sharing your story and your perspectives, Dr. Hilton. We really appreciate your time.
Thank you. Have a great one.